really happy that you guys came today to just see what we have to offer. There's going to be presentations throughout the day. You can kind of pick and choose which ones you maybe want to listen to. So I have the pleasure of going first. My name is Hillary. I am a therapist, LMFT technically. I can do EMDR, EFT, but one of my specialty areas that I focus on is chronic illness and chronic pain because I myself have it. So do you guys know anyone who has, any of you, chronic illness, chronic pain, invisible illnesses? Yeah. So when you have those friends or those family members that have it, what do you typically see that lets you know they have those diseases? Nothing.
They don't.
Right. So most of us who have chronic illness or pain, we tend to do really well at just appearing normal, right? We keep it internal because part of what we have to do is just manage it so that we're not letting everyone know how hard it is. So chronic illness is defined as a cognition that lasts at least a year or more and requires continuous care. Chronic illnesses can include heart disease, kidney, illness, Alzheimer's, dementia, IBD, which is the irritable bowel diseases, which is different from IBS. And there's a lot more, obviously, like TBIs. If you have any type of paralyzation, any type of physical ailment that removes body parts also falls into that category, but those you kind of see. The way that it works is whenever someone has chronic illness or pain, their brain actually shifts because that emotional tie to the pain, actually the biomechanics of it, it changes how your brain functions. So it changes how you're able to hide those symptoms, the pain, while also attempting to move through your life, right? So most people with chronic illness or pain tend to have one of two things or both happen, which is depression, anxiety, or both. And that, again, comes from the way our body is trying to manage that illness and pain on a consistent basis. And it basically becomes very hard for the medical doctors to know how to handle that piece along with just treating the actual illness or pain. So that's where we come in, right? So there's a lot of studies that show that people with chronic illness or pain who are also suffering from the depression, anxiety, both. So people who also have PTSD that's sometimes tied to their illness or pain, or medical trauma that we tend to experience with chronic having to go to the hospital, go to the doctors. Studies have shown that EMDR, mindfulness, acceptance and commitment therapy, a lot of those are really beneficial to people who have the chronic illness and pain because it gives them the skills to look at their illness just a little bit differently. And when you're able to accept that it is chronic and that it isn't something that's going away, it does give you a different level of strength so that you can utilize finding ways to also still be happy, right? To still enjoy life with those few adjustments that maybe you have to make as you continue to go on with it. So some just stats, 79% of people with chronic illness or pain do test, they report positive for the depression, the anxiety, or a combination of both. 45% of people who have PTSD or complex PTSD also report having a chronic illness or pain. And again, most of these people, if they're just walking down the street, you don't know there's anything wrong with them, right? So we also see that a lot with people who might have a handicap placard, but they can walk. People assume they're lying. So that adds a whole nother layer to the experience for each of these individuals, is because they hear all the time, well, you don't look sick, you don't act sick. And that is a challenge because you're trying to not appear sick and so that you can actually function and feel good about your day. And chronic clusters that people experience when they have that pain or illness can include fatigue. This one tends to trip people up a little bit because fatigue, you can have fatigue as just like a normal person, but when we're talking about the fatigue that comes with chronic illness and pain, you can be fine and then you're knocked out and you cannot get up. You cannot keep your eyes open. It is a whole different level of an experience than just like, oh, I did way too much today, right? Then we also see that it has irregular sleep. So we sometimes see a lot of people that'll have either they can only sleep in small clusters, or they'll have insomnia that makes it really hard to sleep, or they'll have difficulty staying asleep. And again, that's just from all of that dysregulation that goes on in the brain, trying to manage these things while also just keeping you alive. And mood disturbances obviously ties into the mental health. So some things that they're starting to do on the scientific and doctor research side is trying to figure out how to better prepare doctors to assist and recommend and, work as a team with mental health individuals, because that is a piece that they don't often think of at first. When you're giving someone a diagnosis that's chronic, that's one of the first things that should happen. So they have someone going through that whole journey with them. But even if it's not right away, the sooner that it can happen, the better for that individual, because they're going to be aiming to feel a little bit more accepting and positive from the very beginning, right? And so here, any of us can work with anybody that has any type of illness or had a medical trauma or anything, because it really is just about supporting that person and then helping them redefine what they look like to themselves, what their life looks like in that positive transition, despite having the chronic illness or chronic pain or any type of medical trauma, right? And that's just one small piece of what most of us are able to do here, and you'll be able to hear a lot of the other specialties that we all have throughout the day. But I did want to just leave a few minutes if any of you have questions or curiosities about it. Yes.
I have a couple.
Okay.
I'm wondering about the role of grief and loss for people with chronic illness and chronic pain, being that this is an ambiguous loss that's often hard to explain to their loved ones and family members.
It is not your typical grief, right? Because it's essentially ongoing and you never know what is going to happen next. And so you're kind of stuck in that grief process, because every time you maybe get close to being like, ooh, okay, I've done everything I can, I feel really great. Most of the time something's like, hey, what about this? What about this over here? Let's do this, let's try that. So it is something where you approach it a little bit differently. And when I work with people, I try to have them do it kind of like piece by piece, experience by experience, not the totality of it. And breaking it into those smaller pieces gives them that sense of progress, gives them that sense of positivity in themselves to then take on the next little part of that whole journey. You said you had another question?
I did, yeah.
Okay.
Yeah, thank you for that.
You're welcome.
You mentioned EMDR and ACT as effective modalities in treating. Are there any modalities that would be inappropriate for use with this population?
I would say more of the solution-focused CBT, more short-term therapy is not going to be beneficial because it's not something that's short-term. And it's not our behaviors that need to change. It's not our thinking in the sense of using it as CBT. It's more of really shifting the perspective, because anytime you go through those big things, cancer, any type of heart attack, any type of thing that keeps you kind of in that anxious state, wondering what's going to come next, you're not going to be able to do that with those really structured therapies.
That makes sense.
My doctor just doesn't listen to me, doesn't understand me. What's some tools or a tool you could kind of get with them to kind of express those feelings properly with the clinician?
So with those types of individuals, and having gone through it myself, it's really about moving into that space of being comfortable with being assertive and continuing to advocate for yourself. And if that means going to different doctors, continuing to just kind of force it upon them to stop and listen. An example would be that in 2021, when I was in the hospital for my ulcerative colitis, I knew my colon needed to go away. But most of the doctors that I had been working with were like, well, let's just try this, let's try that. And I said, absolutely not. When my surgeon came in, it was like this halo of wonderfulness, because the first thing he said is, it's your body, so it's your choice. And I was like, can you say that again? One more time for me. And it made such a huge difference as far as how I felt with this whole journey I had taken, because that was the first time someone just simply said, yeah, if that's what you want, let's do it. And I'm not going to talk you out of it, because he fully embraced what I was telling him was my experience and that it was true. And that's a large piece that we often, most people with any medical thing they're trying to figure out, it doesn't have to be chronic, is that it is that much harder to break through what they've been trained to see or trained to recognize, instead of listening to those of us who are very attuned with our own body and know when something is wrong. Like, I have not had a single time in the last 5-6 years that I didn't feel like something was wrong and then it was just nothing. It's always been something. And so I work with individuals to help them feel really valid in what they believe is going on, what their experience is, what they're feeling, and how to then dictate that to their doctors with assertiveness, but not like anger. But to really be able to go into those appointments prepared, to feel confident that they're going to be listened to. And typically I also have them have someone with them, just for like that buddy system that gives them that extra level of strength and confidence, because they don't feel like it's just the doctor and them. And so that tends to, and I'll do a lot of prep work like the day before, the week of, and really we'll just kind of practice that role play of them being able to say, here's what's going on, here's what I would like to have tested, here's what I'm experiencing, what can we do, what's the next step for this and this. And that way they come out of it feeling like everything was listened to. They got through their whole list, and then they feel like it's good because they're going on to the next step with the doctor also on their side.